Hey everyone, it's Dr. K. So as clinicians, we know that we have a powerful role to play in helping maintain your healthcare and your overall well-being. We know our words have power, so we have to do better at being more precise when we're conveying information to patients to help them get clarity on their problems. Unfortunately, this isn't the reality because not all doctors are built the same, just like not all coaches are built the same, not all gyms are built the same, but the point remains that our words matter because they build a foundation of trust between ourselves, the clinicians, and the patients that we see. So overdiagnosing is a problem in healthcare, and a big one at that. For some reason, clinicians label people in ways that don't necessarily benefit them. What ends up happening is it creates a situation where ultimately there's wasted time, energy, money, and healthcare resources for the patient. Now, I'm not saying people don't need labels because labels help capture a lot of information to characterize, for the patient what's going on, helps give them clarity. But people come in to see me all the time that identify with their labels. And, what we really pride ourselves on is identifying, and helping people to understand those terms. Labels can cause harm. They create, a catastrophic looping effect, fear avoidance and anxiety and fear of movement and activity. And, that person might interpret their label differently, but if someone comes in to see me with an MRI of their knee that shows there's a meniscal tear, we may not prioritize certain treatment options over others, but, that doesn't necessarily mean that they need surgery. There's research out there that says they can do a lot of things to avoid surgery and that surgery is not necessarily a first-line therapy. So, having something brand new happen, or if there was an acute injury, adding a label to it makes sense because we need to identify the structures involved that are responsible for that pain or injury or dysfunction. But chronic conditions, like we see in exercise and sports medicine, are harder to do that with. If imaging reveals structural changes like a loss of a joint space or some sort of disc changes, doesn't necessarily correlate or relate to the pain or dysfunction that person is coming in to see me for. So why give them a label that suggests that they are unhealthy, or give them a label that suggests that they're responsible for their harm? The worst is whenever clinicians tell people, oh hey, there's arthritis on this imaging, which is basically just wear and tear, and they say, hey, even though you're young and healthy and active, we want you to start avoiding movement and avoiding exercise and avoiding activity with your family because it's going to aggravate your arthritis. And that's just not relevant. All right, red flags make sense to us because they identify what we need to move and act quickly on, but a label can do more harm than good. Especially if it doesn't change the management of that problem. So if you have degenerative changes on your knee or your shoulder, but it doesn't apply to why you're having the pain that you're feeling, then it doesn't affect the treatment plan. And so why are we going to start to tell you that you have bad knees or bad shoulders? So if we're going back and thinking about labeling and it's limiting your treatment options, a highly skilled clinician is going to understand that. And you don't just rehab or strengthen or desensitize specific injured tissue, but you need to incorporate the full picture, the entire kinetic chain. So we see a lot of clients who come in the door with labels based off of some imaging that a doctor has done and maybe kind of skimmed through and gave them a brief explanation of, but these people, they walk away and they say, hey, I'm really frustrated because I used to enjoy doing XYZ, but an x-ray my doctor took on my back showed some arthritis changes, some degenerative change, and they said, hey, like this is something that you need to start being afraid to do. Don't exercise anymore. If you have pain but you're able to load it, then you should be able to work at an activity level that's safe and fun to where you can still spend time with your friends and family. I would ask you to start thinking and looking for a fresh perspective if you've been given a bad label in the past. It's my hope that this will at least help you get an understanding and stimulate a conversation between you and your doctor. That way, you can have an understanding of the language and concepts involved, and that just because you might have a label that you've been given in the past, it's not a limiting factor for you overall. You need to be your own best patient advocate and identify any of those harmful phrases and terms and ask your healthcare provider for clarity on the situation. Whether or not you need more in-depth conversations on that subject, or you need something to account for long-term activity levels, or a change in your prognosis, or more imaging. This should all help you get better clarity on your situation to change your perspective so you feel comfortable pursuing active rehab components, strength conditioning, loading, moving, and avoiding any unnecessary structural interventions like injections and surgery. Now, those options are still on the table, but they should be used if all of the conservative care has been exhausted. I'd love to hear your thoughts on this. Let me know what you're thinking. Stay strong, inspire others.